everyone. Myself Dr. Kalyansing Gothwal. I am a consultant oncosurgeon in Kaman and Bajaj Hospital, Chhatrapati Sambhajinagar. Now we all know this month, October month, is a breast cancer awareness month. So by taking this opportunity, I will like to share regarding few thoughts regarding the breast cancer. What should the common people should be much know about the breast cancer? The breast cancer is the most common cancer in India. Basically, it's the second most common cancer. First and foremost is the cervical cancer. Like in cervical cancer is most common, especially in rural population. But the breast cancer is the most common, especially in urban, also in the rural population. Now, if you see the statistic by Indian ICMR guidelines statistic, usually in India or in the all over the world, 1 in 8 women usually develop breast cancer in their lifetime. So you can be aware that how much is the common is the breast cancer. And in India, if you see the last 1 or 2 years statistic, in the last year around 1,78,000 women develop breast cancer. So this is a most common cause for mortality in a female population. Now if you see the breast cancer, if there are suppose 100 patients of a cancer in female, of which 15% will be the breast cancer. So you can analyze how much is the breast cancer. If you are seeing what are the risk factors for developing a breast cancer, the first and foremost important is your age. As you increase, increasing age is the single and most important risk factor. Again, female have 10 to 50 times more common risk than male counterparts. That doesn't mean that male doesn't have risk. Male also have a risk of breast cancer, but female have 250 times more common. Again, the other risk factor like early puberty, early menarche, late menopause, hormone replacement therapy, obesity. Then there are 10 to 15% of patients have hereditary breast cancer. They have history of developing breast cancer from their mothers to their granddaughters. So 10 to 15% are familial breast cancer. So can we detect this breast cancer at an early stage? Yes, we can detect this breast cancer at an early stage by doing screening methodology. So what are different screening modality to detect the breast cancer at early stage and to save more lives? So first and foremost is the clinical self breast examination, especially twice a month or once a monthly at a one time. And if you get any abnormality, which abnormality sign symptom you will develop in breast cancer, like you may feel a lump, you may get a nipple discharge, especially bloody nipple discharge. Sometimes you develop a swelling in the armpits, or you have discoloration of your breast skin. So if you are getting any of these sign symptoms, then you have to consult your general practitioner or your consultant doctor, like any oncologist also. And after once you feels any lump or anything else, your doctor will advise you some basic tests, like he will advise some mammography. Then the other importantly, you will require tissue diagnosis like biopsy. So once mammography and biopsy is done, then we usually discover patient will stage the disease by doing additional tests like CT scan or PET scan. And after discussing and investigating, we usually clinically stage the disease, whether it's a localized disease entirely within the breast, or it's a disease in the breast spreading into the axilla, or it's a disease spreading from breast axilla into the other parts of the body like bone or liver or lung. So based on that stage, we plan further treatment for the patient. If you feel any signs, symptoms, or if you feel any lumps, then consult your doctors, do screening investigation. Even if you are not having any signs, symptom, but what the international guideline American Cancer Society suggests that each and every woman more than 40 years should have done a screening mammography every yearly. Thank you.